Gray, the Director of Health and Human Services. And it's my pleasure to be able to introduce this forum to all of you, because this has really been a journey led by Representative Nathanson and responding to changes in the healthcare landscape in Eugene in particular, but even the broader metro area. We all know that the University District Hospital closed just over a year ago now. And there were a lot of questions in the community about what do we do? How do we respond to the loss of healthcare services within our community? And we were so fortunate when Representative Nathanson stepped in and started facilitating meetings with groups of stakeholders who had expertise in this area to ask, what can we do? And this forum today is around the outcome of what was done in the last legislative session, thanks to Representative Nathanson and House Bill 4136, which she authored and sponsored. But beyond that, she has continued to lean in to the work on what does the future of healthcare look like and what does healthcare access look like in Lane County, or what should it look like. So I won't steal any more thunder about House Bill 4136 because that's Representative Nathanson's to share. But I just wanted to share personally my appreciation and gratitude for having such a wonderful, supportive legislator here in Lane County who's really working on solutions to the problems that we have in our community. So with that, it is my pleasure to introduce Representative Nathanson, and I think she'll go ahead and introduce the panel. All right, thank you so much. Oh, and you want to use that one?
This is fine. Thank you very much, Eve, for the very kind introduction. Hello, everybody. I'm really glad you're here with us to hear about this tonight. Some of us, some of you, some of everyone here have been in many, many meetings. We're used to being in meetings talking about what we wish would happen, talking about what we want to happen, talking about planning for what should happen. This is a meeting that's much more exciting because we're talking about what happened because we did the talking, we did the work, we rolled up our sleeves, and now we get to hear what is happening. So thank you for everyone for helping make this a real positive difference for the community. We're going to hear from 5 people showcasing the work that's the outcome of the state legislature's funding in the innovative healthcare programs in Lane County. And I want to be very clear that it took the entire delegation to help pull this off. So the entire delegation that helped sponsor the legislation included Speaker Julie Fahey, Representatives Paul Holvey, Charlie Conrad, Senator James I. Manning, and Senator Floyd Przonski, who is with us tonight to help with this. Senator Przonski, thank you very much. Also here today is Representative John Lively. We also have County Assessor Mary Vuksik-Schaefer here, and Representative-elect Lisa Fragala, you're here, yes. And Lori Trieger, County Commissioner, who's been extremely supportive and participating for months in helping make this happen. So I want to talk for just a minute, a quick recap of how we got here. In August of last year, we heard the announcement that our only hospital and emergency department would be closing with about 90 days notice. That's pretty fast notice. The hospital was serving at that time as an entryway for immediate access to medical and behavioral health care. It was emergency and non-emergency, and the closure was clearly going to leave a gap in the community's access to care. In September, key stakeholders started meeting together. That included legislators, including Senator Przonski, who's joined us. Representative Lively heard about those meetings. We also had a number of people involved in the healthcare community and emergency services participating. We talked a lot about what the closure would mean and how we could start mitigating the impacts. We focused on identifying specific problems that we could feasibly address at the local and the state level. We knew we couldn't rely on just doing the same old stuff. The same old stuff wasn't working for everybody. In fact, it wasn't working for a lot of people. We needed some solutions fast, but we were focusing on the future, not the past. A few of the key points that we discussed had a direct impact on the legislation that our delegation proposed to the legislature. First, that hospital emergency departments were overwhelmed, patients were and still are waiting for hours. Ambulance crews were waiting a half hour or more to offload a patient to the emergency department. There was no 24/7 urgent care available other than what was being provided by Peace Health Hospital. Urgent care is not necessarily available to everyone, and no one knows where all the urgent care facilities are, or what services they offer, or whether their insurance will pay for it. So they go to the hospital. Staffing shortages were exacerbating the problem, particularly shortages in the nursing fields, and some of the patients that were being transported by a $250,000 ambulance were being transported there with very highly skilled paramedics or EMTs to a high-cost, stressed out, and overflowing hospital ED, and some of them could have been taken care of just as well or maybe even better with a different kind of response. And you're going to hear tonight about right size and the 5 rights for patients. We dug into ideas to ensure that access to immediate or same-day care would be available. We wanted to be diverting non-urgent, non-life-threatening events to other care if appropriate. And we did not want to overwhelm our EMS responders and emergency departments. We were looking for solutions to all of that. The bill had 3 parts. First, bridge funding, one-time funding of $1.3 million for staffing an additional ambulance crew to transport patients longer distances and waiting to offload patients to the ED that was already crowded. Provisional licensing for nurses. We were going to enable employers to hire nurses currently licensed and in good standing in another state once they applied for an Oregon license, to let them get to work immediately in Oregon while their application and credentials were being reviewed. And the best part, that's what we're going to hear about today, the Innovation Fund. That's one-time funding, but we think it's going to launch something that we hope becomes permanent. We had a hearing on the bill in February. The legislature passed it in March, and progress has been at something like lightning speed for government. Lane County designed a fair, open process, selected programs for funding by the end of June. The program sponsors went to work immediately, and here we are now, just months later, seeing new things happen already. So huge kudos to Lane County and all of the partners who made this happen so quickly. I'm so glad to introduce to you now our first presenter, Chief Chris Heppel.
Okay, great. Thank you, Rep. Nathanson. I'll tee it up a little bit, and I'll transfer over to Alicia to talk about their side of the house, and then maybe come back to me. I'm going to talk first about our alternative response unit. As with any good idea, it starts on the back of a napkin, and that's certainly what you see in this slide up here was my initial thoughts and ideas, and then staff added in a little bit color. And we transitioned over to what we call an alternative response unit. Our goal with this unit is Rep. Nathanson teed up a little bit, is about the patient's rights. And this is something that I've kind of worked on in my career over the years, and that we're really trying to get the right patient, the right resource, the right level or service of care, utilizing the right mode of transportation to the right destination. And why that's important is because since EMS started back in the 1960s, it was simply you get 1 or 2 choices. It was a basic life support ambulance or an advanced life support ambulance. And we really need to start changing that up. And we're doing that in partnership with Peace Health. And I'll turn it over to Alicia to talk a little bit about their part, and I'll come back to the slide here in a moment.
Great, thank you. And thank you, Representative Nathanson, truly for bringing such a great, robust group of individuals together to problem solve and put these plans together. I'm filling in tonight for Dr. Robin Virgin, who's the CMO for our Peace Health Medical Group, and she worked with Chief Heppel on this project. But as we looked at this opportunity, we also really reflected on the pandemic, which accentuated the benefits of community agencies partnering to bring the best of each respective organization's energies, expertise, skills, and resources in the spirit of promoting the health and safety of and well-being of our community. And this particular project is really an opportunity for Peace Health to develop a more robust partnership with Eugene Springfield EMS by embedding a Peace Health employed advanced practice clinician or a nurse practitioner or what we call a nurse or what we know is a nurse practitioner or a physician's assistant into the EMS service model to respond to low acuity calls. And the plan is for the APC to go out with EMS and evaluate and treat when out in the field. And then a few examples of that are treatment in the community could include e-prescribing, general sickness or upper respiratory illness. And then they will they will only transport to the urgent care or to the emergency department when there's a need for a higher level of care. And with that, when they do make a transport, really what I love about this model is focusing on the patient and ensuring that there's a warm handoff with the EMS team as well as the provider, whichever service they're bringing the patient to. And then, as we look at this, the project really highlights the collective passion that Eugene, Springfield EMS, and Peace Health has in getting it right for our patients. So with that, I'll turn it over to you, Chief Hubble.
So if you just take a look at the more refined model to the right, the way that we do the right patient is all of our patients that'll experience this service actually come through our 911 system. As you can imagine, we see just over 100 patients a day in our 911 system. And many of them don't need an emergency room. So that certainly was an impetus around this whole piece. Getting the right patient, we actually have what's called medical dispatch priority system, which will triage out the call into a higher acuity to a much lower acuity type of system. And then we have it programmed into our computer-aided dispatch system. This unit will go out on those lower acuity systems or calls, and I'll show you their geographic area, what that looks like. Let's not quite yet go. Let me slide back one. Getting the right resources, the ARU, if you notice just with the right levels of service, that's everything in the red there. Many times we go on a call and there is no patient to where we inform, self-care, et cetera, or we can also connect with services, and we can consider connecting with services being a destination. Also remember, sometimes calls are not what they appear, so we could very well show up on a call and it's maybe a chest pain or a stroke. We can escalate the system. We do have a safety net in place, which is our traditional system for these folks. So thanks. Next slide. In terms of looking at the system component, there's two pieces here. The first one is alternative medical response, which we've been working on for years. In the left-hand side there, what you see in the blue is current systems that we have in place, not just us, but also many of our partners such as Lane County, which started their mobile crisis services. Eugene Springfield Fire manages the Cahoots program on the Eugene side. We have squads when we have large events, such as World Athletic Championships or football games, smaller units that can do that, as well as the basic life support ambulance, which Representative Nathanson described. That particular unit runs 7 days a week at our downtown station, which is closest to where University District is, and they see about 9 to 12 patients in a 12-hour period per day in that geographic area. As you move around, our alternative response unit is being funded by the Innovation Fund, and then the green ones are projects or future projects that we have in the pipeline, as we refer to it, that we're looking to get going. I could expand on those into the future if folks would be interested. Over on the right side, we're really trying to demonstrate the fact of bringing systems of care together. Our vision at Eugene Springfield Fire and in conjunction with Peace Health is we have current systems of care. How do we connect them and utilize them already and just make them more efficient? So you could just certainly see the systems here, and many of them we're going to talk about, or the other folks are going to talk about from the Best Med Urgent Care on around, which are being funded, again, many by this innovative fund. Next slide. Our unit, in conjunction with Peace Health, is going to operate probably out of the Peace Health Urgent Care, which is over on Hilliard. They'll be referred to as geocached into about a 2 nautical mile area, as represented by that ring. And the reason for that is what we found in our data set is that's where the highest need would be. It also happens to incorporate the area where the urgent care is located that we'll be working with, as well as where University District previously was. So that's our program and our system that we're working with Peace Health.
Great. Thank you. So you can see that we're moving from a system which was a call goes into 911 And no matter what, an ambulance is going to come get you and take you to the hospital. We're trying to change it into something else where there's more than one choice. And one of the things we were talking about when the stakeholder group was meeting after we heard the hospital was closing is let's talk about not only how to get people to care, but get care to people. And so you heard Alicia and Chief Heppel talking about we're going to treat people someplace else. We're going to treat them in the field, at their home, at a place of work. Maybe it's in a park, but we might be treating people where they have called for help if that's appropriate without taking them to the hospital. So now let's hear from Whitebird, Michael Yoshioka.
Hey. So Whitebird Clinic was selected for our proposal for the Innovation Fund, and we were excited to do this because crisis intervention and this type of service is something we've been doing in some form or another for the last 55 years here in the Eugene Springfield community. What our project will be doing is it'll have mobile crisis intervention teams that can transport appropriate clients to crisis service centers. And currently this is the CAHOOTS team, and it's also open to the MCSLC or other whatever services there might be. This allows them to call ahead after doing an assessment in the field and say, hey, we've got a client or a patient that we would otherwise take to the ER, but can your crisis counselors deal with it? And we'll say, yep, bring them on by. We'll do a warm handoff, and we'll be able to do acute stabilization there at our crisis center, as well as information referral and some follow-up should that be needed. And we launched in mid-August, doing this Monday through Friday, 9 to 5, and we were excited in October to expand it to 24/7. And so now we've expanded our crisis counseling staff that are at our crisis center and able to receive patients 24/7, which is really exciting, is out of the same building that we're providing our telephonic crisis intervention services. And right now we're averaging about 31 engagements a day. And we are excited that we just passed our 25th receival last week. So there are lots to learn, and I'm excited to be back in the space of meeting folks in person. Thank you.
That's great. Next, let's hear from Cascade Medical Associates, Brian Hoyt.
All right, thank you very much. So I want to thank you guys for the opportunity to share kind of what we're doing with this Innovation Fund, and I want to thank Representative Nathanson for bringing all this great group of people together to come up with new ideas and ways to help serve our community. So with telemedicine, that's where we're having interactions with patients, an actual appointment using either a smartphone or a laptop computer. So it is a video conference type appointment. The beauty of that is that you can have that appointment with the patient where they're at. You don't need an ambulance to go get them and bring them to a hospital or a location, but they do need some technology with them. And I'll get to that at the end, a little bit how we're trying to help our citizens with that challenge. But with our goal with Oregon Telemed is to help solve the overcrowding issues in the emergency departments, as well as with overutilization of the 911 system by having providers available close to real time, so appointments within an hour or two of the need. And through the Innovation Fund, we've been able to extend the number of hours that we are open, available throughout the evening hours as well as on the weekends. So Oregon Telemed is a branch of Cascade Medical Associates, and we're actually providers that have been providing healthcare to Lane County for over 40 years, mainly as emergency medicine providers at McKenzie-Willamette Hospital, but also with providing occupational medicine services at Cascade Health Solutions. And we started our telemedicine business in 2020 during COVID, and this Innovation Fund has allowed us to increase our service hours and availability. So some of the questions like, well, how would telemedicine work for these patients? Well, as an emergency physician, I see it quite frequently. Patients are stuck with having to go to the emergency department just for their basic care needs. In Lane County right now, there is a shortage of primary care providers. And if you had like a 50-year-old male who has hypertension, who's out of his blood pressure medicine, his doctor just left town, or he can't get in for 3 or 4 weeks, you call the clinic line, and many clinics say, well, what do? Well, go to the emergency room. So with telemed, you could make an appointment, get seen the same day, get your medicine refilled, bridged until you can get back to your primary care doctor. Another good example is maybe a young, healthy 20-year-old female who has the stomach flu. She's sick at home, nauseated, doesn't feel well, doesn't feel sick enough that she has to call an ambulance, but has to go to the doctor or get a note for their work because their work requires a note to return to work. Through telemedicine, they can be seen within a few hours. They could talk to a provider to make sure that the complaints are just a stomach flu and not something like appendicitis. And they get called in some medicine for nausea, and then also get that work note so when they're feeling better, they can go back to work. And now this nice 20-year-old doesn't need to go into the emergency department, sit around for 4 to 6 hours around other sick people just to get what they know. All they need is a note to go back to work. So there's a lot of opportunities with telemedicine where it can really help decrease some of the utilization of these emergency visits. It's not the answer for everything, but there is a huge ability to use it throughout our community. So just to get an idea, since we started expanding our hours in August, Oregon Telemed has seen over 770 patients. And we've actually seen at McKenzie a little decrease in some of our ED volume. I think some of that may have been due to the opportunities that are happening now throughout our community to improve that access. And we've been working on improving access to telemedicine for the entire community. So we're trying to work with social service agencies and other organizations to set up kiosks, like you can see up on the monitor over there, where a patient could come to a structured location and have an appointment using the tablet in the kiosk so that they don't have to utilize transportation services to get to a hospital and improve access. So once again, I wanted to thank Representative Nathanson for all of your insight and creativity, bringing such a diverse group of people together to come up with these solutions, and it's an honor to be a part of the team. Thank you.
We really are showing people how we can start to reshape healthcare in the Eugene Springfield area. Thank you for being part of that. Next, Best Med Urgent Care, Valerie Simmons.
Hello there, and thank you so much again for having us all together to share what we are doing. So Best Med wanted to support the community and our local hospitals by, as whatever way we could. And so what we're able to do at this time is expand our hours. So we are expanding our hours 7 days a week rather than closing the Coburg Clinic at 8 p.m. We are now open until 10 p.m. And we are also increasing the staffing starting at 3 p.m. so that we can see more patients between the hours of 3 p.m. and 8 p.m. and as well stay open until 10 p.m. Within this urgent care, we do have x-ray services. We have what we call point-of-care testing, where we can do flu testing, COVID testing, strep throat, urinary infections. And also, we have over 25 medications that we can dispense in the clinic. So there is a fee for that, but we are able to dispense quite a few of antibiotics, some pain medications, non-narcotics, and steroids for patients to actually get them treated. So even though we're staying open until 10, the pharmacies might be closed, we were able to still treat those patients and give those services. So one of our goals at Best Med is to try to keep patients out of the hospital appropriately, and so hopefully by extending these hours, we'll be able to do that.
Thank you.
And that started November 1st. I should add that part in as well. November 1st, we started that. So we're there for the community now.
Terrific, good to know. I know people who had not been going because they knew you closed at 8.
There we are.
We want them to know that help is available for longer hours now.
Yes.
That's great. Lane County, Jocelyn Warren.
Good evening, everybody, and thank you, Representative Nathanson, for the opportunity to give an update on our project, and it's really broad. It's Lane County Health and Human Services. Ours is a collaboration between Public Health, our Human Services Division, and our community health centers. As you can see from the slide, we have two strategies to increase access to primary care for people experiencing homelessness, and those are the strategies that we're testing. And hopefully by increasing that access, we will in turn decrease the transportation to emergency departments for those low acuity visits that have been mentioned earlier. And we are expecting to get started within the week of providing transportation from the 2 shelter sites that we are going to start with, which is Eugene Service Station on Highway 99 and our navigation center at 100 River Avenue. So folks will be able to make appointments, often same-day appointments at our new West 11th Community Health Center clinic, and we will be able to provide taxi transportation to them, which, we're hoping will help people take advantage of that opportunity. The second strategy is for our big 2-exam room mobile unit, and we will be out 1 day a week at each location, the Eugene Service Station again, and then the Navigation Center at 100 River Avenue. And we've just identified primary care providers from the CHC, so I'm hoping within the next couple of weeks we will be able to get out and providing care at those 2 locations as well. So.
This is really fun to hear about all the new ways of getting care to people. That I really enjoyed hearing those really quick summaries. We have time now to entertain your questions for these people about what these new programs or services are. We're very happy that they're already in place just months later. Again, it was lightning speed, I think, for the Lane County legislators to see that we could propose something to our colleagues. We're in a session in Salem. It was approved by the legislature, and in less than a year, the new services are already out on the street, if you will. That's really great. There are some other new developments to let you know about. Some are already in the works, some are announced, some are in the planning stages. You maybe have heard about the new Behavioral Health Crisis Stabilization Center at the Peace Health Riverbend campus. We're so excited to hear about that. Another urgent care clinic will be arriving in Eugene probably in a month or 2. Optum has announced plans to open an additional urgent care clinic. And there may be a new freestanding emergency department for Eugene. That's in the planning stages, needs to go through approvals, permitting, and all sorts of things. It's an idea, and we'll just have to stay tuned to see if that idea materializes. But we're happy to take your questions now, and I hope that Senator Przanski will be willing to come up and help manage questions and answers, because the senator has been really involved in, it takes the House, the Senate. We've all been working together, and Senator Przanski and I have continued to work together very closely on ideas even for the next legislative session. But the senator can help with this part of the program.
Thank you, Nancy. So I'm really just here just to make sure we don't get rowdy. So we really just want to have you ask questions about what you just heard. This is the presentations. I know some people may want to talk about other things, but tonight we'd like to just make certain we got our presenters here to answer questions based on what we're expecting to happen. So if you have a question, just for make sure everyone can hear, if you would be so kind to come up to the podium where we have a microphone and ask the question, that'd be great. And you don't have to rush up, but come on up.
Howdy. My name's Tom Peck. This is really incredible for our county to pull this together. It's exciting. It makes you proud to be in this county. 2 quick questions. How are we going to let the community know about this? What's the marketing budget for this? And then 2, I know this was about $4.5 million. What happens, what's the budget for the distant future in 2 years, let's say? Are we still going to have to refund this? So, thank you.
I'm going to say the first thing, and then everybody else add to it. For marketing, you're seeing this is part of the program to make sure that we announce all of these programs have been launched now. New services are available. The media is either present with us or they're monitoring it remotely. We understand at least one news outlet is monitoring this live as it goes on, as it's being broadcast. So this is the initial phase of trying to get the word out to the public. So thank you for that question. That's a big part of why we're here tonight, to start helping everybody become aware of that. As far as the money, yes, you're exactly right. It was one-time funding. We are hoping that the partners see that we are achieving overall system savings and can redirect funds and keep investing in these alternative approaches. But I'm going to ask other people to respond.
I'd say just from a tongue-in-cheek perspective, when we look at the 911 system, we joke in the sense that it's probably one of the most successful government agencies or programs where you can dial a 3-digit number and within 5 minutes somebody shows up. And so that actually has created much of the challenges that we're experiencing today, is that overutilization or even inappropriate utilization of the 911 system. And so our piece with this is the educational process. Once we educate our crews and we're seeing our patients on a regular and daily basis, having what we call inventory or destinations for them, and to be able to connect them to something other than the emergency room, whether it's through the telehealth component or to an urgent care, et cetera. The healthcare system can be difficult to navigate. And so that's a big piece of what we're going to just try and do out there with our initial project, is from an educational perspective. And then hopefully that will be the ripple in the pond, especially when we start talking about the utilization of 911.
Thank you, Senator Brzezinski. I'm John Lively, and I really appreciate, this has been great to get kind of the sense. And on the surface, it just makes so much sense. It's one of those things you think about, so why weren't we doing some of these things before? But we get stuck in the mold. But the question I have is with the telemed, and I really think that's pretty exciting, those kiosks. But these other programs, I understand the handoff. I don't understand the handoff as much. So if you're dealing with somebody on a call, and the issue is bigger than what you can deal with in the call, I'm just trying to understand what the handoff is in that situation.
That's a very good question. I think that the purpose for the telemed is to take some of the lower acuity type cases, maybe those cases where somebody say, well, I need to go to urgent care, but I don't have transportation, or something more convenient where you can do it from your place of work or at home. The timing of that would be an appointment ideally within a couple of hours of asking for the appointment, so it wouldn't be the replacement of like a 911 call at this point. But the other nice thing about the telemedicine is for those Lane County citizens that live just outside of the immediate city area, even an Uber or a ride share from a town of Coburg or Cresswell could be quite a cost, whereas telemedicine might be able to meet their needs for that immediate problem.
If I might just follow up, and I appreciate that, makes sense. But I'm just thinking about those of us that may not have figured this out quite enough before we make the call. And on the call, you determine it's more severe or there needs to be something different than just the telemed call. Because if you're home and you don't feel well, and that's one thing, but I'm just concerned there may be those circumstances that people are more severe.
That's a very good question. And so we do have people that are answering the phones to do the scheduling, and they do ask what the purpose of the visit is, and there are protocols for identifying higher acuity things that shouldn't wait and redirect them back to either 911 or going to the emergency department. It's a good question.
Hi. Thanks for taking my question. I'm Sandra Root. I'm with the Community Health Centers of Lane County. I primarily take care of children with either Pacific Source or Trillium CCO coverage. One of the questions I have, or maybe it's an urging, is to consider folks who have that kind of coverage or no coverage at all as we're looking into some of these opportunities for folks. I think one of the reasons that the emergency department has become so overused by some of these populations that we serve is because they know they can be cared for there, and they don't have to figure out the insurance payment issue. Some of the different services that we offer that we're discussing today, some of the urgent cares don't take Trillium or don't take Pacific Source or have different rules that change from time to time. So just urging for that to be something that's well advertised and ensuring that we're covering all of our population. Thank you.
Good evening. I'm Jensina Hawkins, and as a community advocate, first of all, thank you, Representative Nathanson, for your tireless efforts and for letting me bully you on the stage at the first Citywide Healthcare Forum in September. As a police commissioner, thank you for all of the efforts that are being undertaken to relieve the stress on the dispatchers. The police commission, we have no oversight, but part of what we will look into for policies is the 911 comm center. And I've done ride-alongs, sit-alongs there, and it's amazing the amount of pressure that they're able to take and should never have to. So I appreciate that. As Mrs. DeMont Hawkins, my husband is the president of the NAACP. My question is, how do we find out how to partner for those kiosks? And I'm channeling my husband here because I know that his first question would be, how do we get one at maybe the MIMS house or at the Black Cultural Initiative?
Well, we are happy to speak with anybody and look at that. We are looking for places to strategically place them to allow the best access to the most people. So you can get in contact with me after the meeting. I'm happy to share that with you.
Excellent. Thank you.
Thank you.
Hi, I'm Bernie Corrigan. I'm unfriendly area neighbors, but I'm not representing them. I think this session is absolutely fantastic. Is it being recorded? And if so, how do I direct people to see it?
It's my understanding that, yes, it is being recorded, and could I ask someone to respond for it? I know that if you write to my office later, in a day or two, we'll figure out how to get a link and share it with people. There may be something more direct, though. That
if you go to the Lane County Health and Human Services Facebook page, okay, great, great, good. If you'd like to request a copy, we can arrange that. That's fantastic. Yeah, great.
And speaking of which, I have a question from our live feed that was messaged to us. I'm not going to read the name of the person who asked the question because I didn't get permission to do so. So the presenters talked about the calls they've taken, but is there any way to track whether this is having a positive impact on the emergency room visits? And if so, will that information be publicized?
So I could talk about our program with the Alternative Response Unit, and we're using the Advanced Practice Clinician on board. That is one of the metrics. As part of House Bill 4136, we have to report back to legislation by August. Our report needs to be done by August of next year, and then it's probably presented in ledge session in September. And we plan on tracking that piece. The nice part with, for us, connecting with the hospital, a larger hospital system, is about 75% of the patients that we transport go to Riverbend, which is a Peace Health facility, and we're working with Peace Health. And so we've been working with Dr. Virgin in terms of how we track that using the Epic system, and then how do we also track that using our pre-hospital care system, and then bring that data together. And so one of the questions will simply be is, one, did we see a decrease in volume? It's kind of like this binary piece. But the other component is, the partner for the advanced practice clinician is a paramedic. In fact, she's a 30-plus year paramedic. So she can really know the difference between sick and not sick. And a piece of that, of her role in that, is to say, if not but for having the APC, would we have transported this patient to the ER? And so, we'll track that component. And I can't wait to see how some of those conversations go between the APC and the paramedic to go, do we transport or not? So absolutely, for our process, that's what we intend to do. And we plan to put that in a report and present it next fall.
And I would like to add, for the project that Lane County Health and Human Services is doing, we also work in Epic. So we will be able to look and see if the utilization of the folks that we are getting connected with primary care through our project have more, have a decreased utilization of emergency departments once they've engaged with our project. And we'll also be able to look at if we were able to get them a prescription, somewhat like with telemed. It's like, and would you otherwise have had to go to the ED to get this? And we've been able to, take care of it over here instead.
Hi, Nathan Wilk, KLCC. I'm curious throughout this process, looking at strategies to try to reduce overuse of the emergency department. Are there other jurisdictions, cities, counties that you have seen use these strategies correctly, or rather effectively, that you're pulling from, that you're taking inspiration from?
Jump in. I could say for our side of the house, yes. While the vision came out on the napkin, that's a culmination of seeing a lot of different systems. But again, tongue in cheek, in the emergency medical services world, we say when you've seen one system, you've seen one system. And so we take a lot of those ideas that are working in other systems to incorporate this piece into that. One of the pieces that we connected to real quickly was, especially with the 911 system, there is a lot lost in translation between the person calling or calling for someone, how the dispatcher interprets that, how that goes to the crews, what the crews